Hi, my name is Dr. Vicky Goodyear from the University of Birmingham and in the School of Sport, Exercise and Rehabilitation Sciences. Now, I'm part of the Birmingham Heroes campaign, which is a project that's looking at how we can redefine the 21st century body. Now, my involvement of this is around looking at the role of things like social media, apps and wearable devices, so digital technologies, and looking at it from a very youth perspective. So how does social media, for example, impact on young people's health and well-being? Now, the reason I've been quite interested in this is my background is a physical education teacher. So I've been researching at the University of Birmingham for 4 years, where previously to that I was at the University of Bedfordshire, and before that I was a teacher practicing in schools, teaching physical education. So my passion is really about how we can promote young people to develop positive experiences about physical activity, diet, nutrition and body image, so that they will be pursuing a lifelong love of physical activity and enjoying the physically active life. So taking that forwards then, I'm interested in social media, apps and wearable devices because young people spend significant proportions of their time on these during the day. So there is evidence to suggest that they're spending over 20 hours per week online, and 2/3 of young people own a social media account. Now, these rates might be higher or lower depending on the young people in different contexts and different international settings, but what we do know is that it's a significant aspect of their lives. So if we want to reach young people and understand something of their worlds and promote their health and well-being, then we really need to know about their perspectives of digital technologies in terms of how they engage with these devices, what they learn from them, and what sorts of impacts do they report on their health and well-being. So in my research, I've been looking at youth perspectives and the youth perspectives on how they use social media, apps and wearable devices. Now, that argument is kind of not always lost, but it's not prominent in most research. What we tend to find is that most understandings about social media, apps and wearable devices are based on adult perspectives or informed quite narrowly from surveys of what young people think about their devices. To really understand the role of the impact, we need to work with young people over sustained periods of times and engage with them and exercise their voices so that they can tell us, okay, this works, this doesn't, this is what happened and this is why it was important to me. And so from that way, we work with young people in schools in a participatory kind of research approach. And what we're trying to do is trying to balance the kind of understandings of the risks and opportunities. So in the news, perhaps every day you might see something on the television that says social media is bad for young people in this way. Schools should ban social media. Most of the time it's about social media is bad for mental health. There's been claims that Instagram is the worst, and there's been suggestions that content should be taken down. There should be restrictions on time spent on social media. The other side of the argument is that some technologies are being promoted as a way to increase physical activity levels or improve diet, nutrition and body image behaviours. And this is mainly from the commercial sector. So we see Fitbits that are now being designed, for example, or various different forms of those for young people. So you might be aware of Elite Band, which is designed for young people, and it's based around a kind of Tamagotchi profile where the steps equates to keeping your pet frog happy and healthy. So this brings a different argument that there can be a positive side to using digital technologies, but at the same time, is it right to teach young people about keeping a pet frog healthy as a way of keeping physically active? And that's something we need to really question. So over the last couple of years, we've been working with young people in Birmingham, but also in Bedfordshire, Buckinghamshire and Berkshire, the 4 Bs, and we've been working with them to understand their role in technologies. So that's involved around 1,700 young people. And what we've looked at is in kind of 3 different projects that are all related together. The first one on Fitbits, the second one on social media, and the third one on apps, health-related apps, so things like MyFitnessPal. So I'll give you some broad findings, and you might take away some messages if you're a physical education teacher, how you might use these in your lessons with young people, or perhaps if you're a parent, a policymaker, a researcher, or a health and wellbeing practitioner, how you might better understand young people's uses of these devices. So in terms of the Fitbits, what we found really interesting was that we would expect young people to be engaged with these Fitbits and them to have a really positive effect on their physical activity levels because young people are using digital technologies. What we actually found was that there was a novelty effect. So similar to how adults go to the gym in January after eating too much at Christmas, the young people that we worked with, we found out that they had a similar month-based effect. So the effects of increasing physical activity and increasing motivation lasted for only about 4 weeks. But what we do know is that some of them did enjoy competitions and step-based competitions that they could have with their friends. They were actually really critical of some of the messages, saying that 10,000 steps perhaps isn't right for everybody to achieve because everybody's bodies is different. So young people from that study, we can say that they're actually quite critical and they're quite self-aware of how technologies work and what's the benefits and impacts. And that we shouldn't be just assuming that we can use technologies in just a way that will just impact on young people's physical activity behaviours. In the second project on social media, our findings were quite interesting, is that we worked with young people to find out what their health-related information they access and what information they actually use. So we worked with young people in schools in different class activities. We created videos. So one of the biggest influences we found on social media was peer influence. Now, typically we would say that we might assume that celebrities, for example, have a big role to play on young people on social media, things like Kylie Jenner, for example, and promoting different body ideals. But what we found was peer influence was really significant. So if young people saw perhaps a selfie that was filtered of a young person their age, they would be more likely to change their behaviours because it was someone their age and someone they could relate to, whereas celebrities were seen as too far and perhaps their bodies were shaped by money and surgery. The other aspect is, in terms of peer influences, was what young people see on social media is largely shaped by their peers. So for example, on Instagram in the search and explore feature, if all of your friends liked a particular thing such as fit tea, even if you did not search for fit tea and you'd never looked at fit tea, that would appear on your timeline. So what we then start to see is kind of this kind of implicit messaging about what types of diets, what types of foods, what types of physical activity behaviours to do based on what you can see on your timeline, and it's based on what your friends have liked and what you engage with. So there's different types of peer influence on social media that largely impact on young people's health and well-being. So in Project 3, we looked at the role of apps and wearable devices in young people's health and well-being. Again, we work with young people in schools to get them to create different aspects of their learning and show and tell. So they, for example, tried out different apps and devices, and then we talked through how they might use them. And they also created their own apps for health. Now, what we found was that apps related to health are used if they're trendy, popular, cool, or in trend. So things like the Pokemon Go was used, and you might remember a couple of years ago it was very popular, and now it's not used as much. We also found that schools, so physical education and the content that's taught to young people, but also parents' uses and family members' uses of apps influence what apps young people could use. So if a parent or an uncle was using something like Strava, they would be more inclined to use that as well. And also parents, for example, were buying their young people Fitbit devices in order to reduce, to tackle perhaps things that are overweight or to improve their physical activity levels. Now, what we found from the young people was that they were a little bit frustrated because there is a gap in the app market at the moment. There are apps designed for younger students, younger people, so from perhaps 11 onwards, and there are apps designed for adults, 18 and over. But there are no apps for teenagers, which is surprising because this is when young people become most interested about their bodies. And they begin to try things out, different diets, even different clothes and different exercises. So there is a gap there, and young people were quite frustrated that there was no age-specific information. Again, they were quite knowledgeable. They knew that they shouldn't be using apps that were designed for older adults because it could be harmful to their muscles and it could be harmful to their growth and development process. So in taking all those projects together, what can we say? Well, we can say that perhaps in contrast to popular opinion, young people are both critical users and generators of different digital technologies. There are some points when they are vulnerable, and what the key challenge for adults is to know when young people are in control of digital technologies and when it switches in control in them. As during the video, we've suggested that young people become interested about their bodies, and that's the tipping points of vulnerability, and that's the points that young people need support with. So we've been working with schools and with policymakers to kind of disseminate these findings. What we're suggesting is that digital technologies and social media should be seen as a positive resource alongside the risks. And adults really do have a key responsibility to help young people in navigating these platforms and realising many of the positive impacts they can have, as well as mitigating the risks. One of the actions that we've called for is a focus on adult digital literacy, and that means helping adults to use digital technologies and understand the various forms of content that are available. So in our work and in the Birmingham Heroes campaign, we have some training videos and guidelines that we've produced for relevant adults and schools, teachers, parents, and these can be used in lessons in schools, they can be used as training resources for adults, and we hope that they will be helpful. So in finishing this kind of video and on the Birmingham Heroes campaign, I'd ask you to consider, can you understand any of the kind of positive impacts about digital technologies in young people's health and well-being? Are any of the issues I've spoken about similar to your experiences of working or parenting young people? And what actions or steps do you think are relevant to young people's needs? Thank you.